So what are the laboratory environment and changes you make to ensure that the egg is safe and secure and sterilized all the time?
It's basically about air quality. That's one of the key points, especially in India, because we have this pollution, and we need to make sure that all these VOCs, which are the volatile organic compounds, which are in the air, in the pollution, we need to make sure that they are not coming inside the laboratory. So one will be the air quality, and we have the air handling units, the AHU, which are filtering all these particles and making a very safe environment for the embryos within the laboratory. That's one of the key points. Then you also have laminar airflows, in which again there are some filters in the cabinet, so all the flow that you have also for the embryos is clean air and is avoiding any other particle coming in the media for the embryos. And then it's all about, again, the incubators and the whole quality control. So we do checks every day about VOCs, about temperature in the laboratory. We do also air validation every some time also in the laboratories. So we have to make sure that all the conditions, especially about contamination, pollution and VOCs, are working perfectly fine, because that's very critical for embryos to grow.
So how do you prevent multiple pregnancies in IVF, sir?
The only way to prevent multiple pregnancies is to transfer fewer embryos.
Okay.
So if you transfer only one embryo to the patient, in most of the cases you have only one single baby, one single pregnancy, a singleton. There might be cases in which you have a blastocyst which is splitting and you have twins. It may happen, but the frequency is very, very low. But the best way to reduce multiple pregnancies is to do also more single embryo transfers. Again, it's a matter of efficiency. You cannot do single embryo transfers if your pregnancy rates and your implantation rates are very low, because you won't be efficient. So first of all will be to optimize everything in the laboratory, also with the stimulation protocols, with the coordination with the gynecologist, to optimize everything in the laboratory about quality. And once you are sure that the quality is okay, you can start offering this single embryo transfer to some groups, to some patients, young patients or old patients, it depends on the case, or open donation cycles with donors. And by doing that, you will be also more excellent. Again, it's a matter of success rate. To me, decreasing multiple pregnancies is also a success rate, because the end point is to have healthy babies and healthy mothers, not just to have pregnancies.
Yeah.
We need to be also aware about the importance of minimizing also complications during the pregnancy and after the delivery.
So what are the major differences you found among the youth and the young people among different countries in India, sir?
I think it's a matter of expectations. Again, it's about culture.
Yeah.
Because again here, the whole thing about the culture is affecting the way they think. Because you're going to get married soon, probably, then you will live with your parents, maybe also here in the country. In Spain, it's something different. You have to go out, you have to make your life, you have to get a good job, and to have different expectations. So again, it's quite different, because here people are also different. Especially, I think that one of the main differences is that probably the women here are more mature. They have so many responsibilities right from the beginning, and they are aware of that. So they are very fast. Women here are so fast learning, so active, and I find this difference right from the beginning. Even in very young women here, they are very awake. It's something very, very interesting.
So how much are Spain people aware of Indian food and Indian culture, sir?
We are aware of that, because in Europe and in Spain, I mean, everywhere you have Indian restaurants. Everywhere. It's easy to find an Indian restaurant.
Okay.
But sometimes they are not that really Indian food, because they are adjusted to the Western culture, to the Spanish way of having things. When you come here, you come to know the real
authentic
Indian food, which is a bit different. But more or less in Europe and in Spain, we are aware of the Indian food.